I'm here with Dr. Azim Kasmani, Public Health and Preventative Medicine resident physician at Queen's University. Hello, Dr. Kasmani.
Hi, Steve. How are you?
Well, we've been doing this for a few weeks now, and there hasn't seemed to be a lot of news. So I think we're going to take a little bit of a breather and start going bi-weekly. I know that I was went to the WIG Standard site just before we went to air here, and for the first time in as far back as I can remember now, which actually isn't far, but still, there was not a single story in the top 10 local news headlines that had anything to do with COVID-19.
Oh, good.
So it seems like seems like we've got it under control for now. Obviously, we know that it's not dealt with yet. Are you concerned that maybe the fact that there's less news stories, that there's currently no cases in Kingston, that may lead people to be slack about the precautions they have to take?
Well, we know at Public Health that we're always ready and prepared, and making sure that we are ready and prepared for an increase in cases. We often talk about another wave, and what does another wave mean? It's another large increase in cases at once, like we saw initially. And some portions of the province are still going through that first wave, where they're still having a large number of cases every day. And so we need to remain vigilant. If we let our guard down, this illness, this virus can spread quite rapidly, as we've seen. And as a result of that, that would cause another wave. So we're continuously reminding people on how to continue to be safe, on how to continue to prevent the spread of this virus and ensure that we don't see another wave soon. We are also looking forward to the fall and winter months when we have influenza and the effects that can have. And around those times, we always see bugs come back, viruses come back, and we want to make sure that this virus doesn't take a foothold in our community at that time either.
I know that it sounds like Ontario has pretty much reduced the number of cases, with one exception, that being Toronto. The larger cities, is that a concern that maybe now that summer's here and people are going to get the itch to go to Toronto, or Torontonians are going to get the itch to come, to a place like Kingston? Is that of a concern?
Well, what we're advising is if you are leaving Kingston, you continue to take, or Kingston KFLA, you continue to take those precautions. So if you're going anywhere, make sure that you're screening the people you're going to be with. Make sure that none of them are unwell, or you're not unwell, because you don't want to pass along any illnesses. And if they are, then you have to delay that trip. If you do go somewhere, make sure that you're not, that the province's guidelines of 5 people together still apply. You don't want to be contravening those, and you want to continue to observe physical distancing when you go places, and where you can't, continue to wear a mask. You want to keep washing your hands, observing hand hygiene, coughing into your sleeve, and being safe. But that screening is the most important step in making sure you're not coming into contact with other people who are unwell, and if they are, it's better to postpone your plans.
Okay. And now, of course, the testing is more commonly available, and in fact, our Premier is encouraging people to get tested. If you're planning a trip, does it make sense to maybe get tested in advance just to see, where your standing is before you go anywhere else?
That's certainly an option. Our recommendation is that anybody who works in a congregate care setting or works with vulnerable populations, if they leave the area and they come back, that they get tested 48 to 72 hours before they return to work, and which would allow the results to come back to ensure that they are not sick when they start work again. And we're always looking out for symptoms. So make sure that if you have any symptoms, you do go access testing. The testing works best in people with symptoms. We're always worried about false positives, and that will throw things off a little bit. And so if you do have symptoms, your chance of a false result is less, but it's something that you can consider for sure.
Let's talk just a little bit about masks and the increasing advice to use them. I read something that had me shaking my head recently, where somebody was actually asking whether they can crochet a mask. And it's like, well, crocheting is very coarse and it's not going to hold anything back. I'm just really concerned that a lot of people are going to be wearing masks that aren't going to protect me, or that I may get a mask that isn't going to protect anybody else. What are some of the guidelines for what you should use to make a mask or look for when you buy one?
So what we know about homemade masks or homemade face coverings or cloth face coverings is that they're designed to protect other individuals from you. And what they do is if you sneeze or cough or as you're talking, any particles that come out then don't spread as much or as far as they would if you didn't have that mask on. So they really work when everybody's wearing them. Unfortunately, they give people a sense of security that if I'm wearing a mask, I'm protected. But in the case of these non-medical masks, that's not how they work. And so the guidelines right now show that you want 2 layers of material and tightly woven material. Cotton and natural fibers are recommended because they still allow you to breathe well. I see people out there running with an N95 mask on. One, you don't need an N95 mask outside of a healthcare setting where there's aerosol generating medical procedures, let alone outside in the open, fresh air. But that can hamper your ability to breathe, and as a result of that, it can have other health effects. But you do want 2 layers, tightly woven natural materials is your best bet.
Okay. Yeah, because I've seen people walking where there's nobody within a half a mile of them wearing a mask, and I'm thinking, well, you're using up that mask's usefulness in a place where you don't really need it. Keep it for when you're in a store or in a setting where you're going to be closer to people.
Yeah, exactly. And the one thing, or the other things to keep in mind are when they become dirty, when they become wet, when they become soiled, they need to be washed. And taking them on, putting them on and taking them off, is very important too. Adjusting them is important. If you are touching your face, touching the area where the mask would come into contact and you're getting those particles on your hand, you're then contaminating your hand and everything you touch afterwards. So if you're going somewhere and you put it on, then don't touch it again until you can take it off for good and put it into the wash.
And probably the best way to put it on is to hold it by the handles, pull the handles over your ear.
Exactly.
And leave it at that.
Yeah, exactly. So if it's one of those strap-on masks, go here. And there's some good videos on YouTube if you Google how to don and doff, or how to take on or take off and put on a mask, they show you the step-by-step instructions, because that's an important point to continue to protect yourself.
One last question. There's a lot of talk now about potentially reopening the U.S. border and letting people come across both ways. What's your feeling about that? Should that be delayed for longer?
I think it's always a risk-based approach, looking at things. When we look at things, we have to keep in mind that families who've been apart for a long time, there may be extenuating circumstances, and the flow of our personal protective equipment, etc. Those are all important factors to take in. We ideally, just as we were saying earlier, we don't want people who are unwell to come back and forth. We want to protect our community, and we know the risk that we know that the epidemiology of the disease in certain parts of the U.S. and in certain parts of the world is significantly different from the epidemiology here in Canada. And so we are obviously concerned anytime there's a risk of a large number of cases coming back to our area.
Well, it's a beautiful sunny day, and I know I'm going to head out and enjoy the sun while we still have it. And I guess we'll talk in about 2 weeks' time, and we'll see if anything's developed, good or bad, in the meantime.
Thanks for having me. Enjoy the weather. Stay safe out there. Keep using sunscreen, wearing hats, staying out of the heat for too long, and be safe.
And hydrate.
Yes, definitely.
Talk to you later.
Take care.
Stay
Thanks for
safe.
having me. Bye-bye.